Good evening, everyone. I'm Jennifer Rice, MLA for North Coast and BC's Parliamentary Secretary for Emergency Preparedness. We are here live on behalf of all my legislative colleagues representing the Northern Health Authority region. From Haida Gwaii to here in Prince Rupert, Terrace, Kitimat and Smithers, up to Atlin and Dease Lake and over to Mackenzie, Dawson Creek and Fort St. John. The Northern Health region is a big geography and also includes Prince George down to Quesnel and all points and communities in between. With me this evening is my co-host Coralee Oakes, MLA for Cariboo North, and we'd like to welcome our special guests Cathy Ulrich, President and CEO of Northern Health, and Dr. Raina Fumerton, Chief Medical Health Officer of Northern Health. I'd like to acknowledge that I'm here tonight on the traditional territories of the Tsimshian First Nations people. I also recognize that you may be joining us from other territories throughout the North and around the province. Before we get started, I want to thank all of the people in the North who are on the front lines. Our amazing healthcare workers, the grocery store workers, the truck drivers, all those working to make sure people in BC get the essential services they need. People were just outside giving them a well-deserved cheer. Here in Prince Rupert, we acknowledge all our frontline workers, including our essential marine transportation workforce, who help deliver the supplies that support our communities tomorrow on Foghorn Friday. Port of Prince Rupert ships and boats along our coast blow their horns to say thanks. I also want to say a thank you to people in my riding and across the North for helping to flatten the curve. I know it was tough to make so many sacrifices, but it worked. And we need to keep it going and continue holding the line. On Haida Gwaii, I've witnessed the collaboration of Indigenous and non-Indigenous communities as a united response to preventing COVID-19 from entering their communities. And at home here in Prince Rupert, I want to give a shout out to the Rainmakers Interact Club from Charles Hayes High School. The Rainmakers have provided hours of online entertainment for those in self-isolation and have also offered up services like delivering groceries for seniors. Thank you, everyone, for doing your part. I'm now going to hand it over to my colleague, MLA Oakes, to give us a quick overview of what this town hall will look like.
Well, thank you very much, MLA Rice, and it's wonderful to be with you all this evening, and it's great to be here virtually. We were joking a little bit earlier. Yes, we recognize that we're going to fight for more connectivity, and we're all in this together to make sure our voices are being raised. And so for all of those who have joined us today, we certainly appreciate. And if something happens, please know we all recognize some of the challenges that we have in such a diverse and beautiful part of the province of British Columbia. These are uncertain times, but I want to join with MLA Rice in just acknowledging the incredible leadership from Northern Health, all of the frontline workers, the essential workers, and everyone who has stepped up. I have been so incredibly proud of the acts of kindness and people just checking on one another. And, you know, my hope is that those acts of kindness, looking after your neighbors, looking after the seniors in our community continues, because we still have people that are vulnerable and many who are still continue to self-isolate. And we need to make sure we're stepping up and that we're looking after them. So please continue your amazing acts of kindness. And I also want to acknowledge that for many of our communities, we're also struggling with challenges around flooding. Many of our communities right now, like Cariboo North, have had significant impacts with, landslides, road closures. And so for many of you, while we're dealing with COVID-19, you're also dealing with some challenges that have considerably altered your lives. And we'll continue, all of us, to work on your behalf to make sure that you're supported. MLA Rice bragged and talked about the her amazing community, and I share that passion. We are so blessed to be MLAs representing such amazing parts of Northern Health. I want to spend a moment, if I may, just to recognize our amazing small businesses. And as we've moved into phase 2, I have seen incredible innovation from small businesses from my community. And I have had, I think, 14 meetings with different chambers of commerce and organizations in the North just to listen and hear from small businesses and take away some best practices. So people who are listening on this call, please know our small businesses are doing everything to make sure that they're following what the public health officials are saying, but we need to support local, we need to shop local, and we need to support our local businesses. So last month, the BC government organized a series of regional health town halls so that your questions could be addressed by the people who have been leading the COVID-19 efforts in our province. Being well-informed and following public health guidelines will help keep us safe and have helped keep us safe. I'm pleased we have another opportunity to bring forward questions that people in British Columbia want to know. So it is my great pleasure to introduce to you again, Cathy Ulrich, CEO of Northern Health, and Dr. Raina Fumerton, Medical Health Officer for Northern Health, who will be answering your questions this evening. Would you like to introduce yourselves to our viewers? Cathy, maybe we could start with you.
Okay. Yes, and I'm Cathy Ulrich, and I'm the President and CEO of Northern Health. I've really appreciated both of your comments about this time that has been unprecedented certainly for Northern Health, and I think for everybody in the communities of the North. We have bent the curve, and we've done it together. And I also really appreciate the comments about being kind and paying attention to how difficult this is for a new normal, finding a new normal in our lives. And we have to be patient with each other, be patient as businesses find their way, as Northern Health finds its way in this new world. But it's a privilege to be here today, and thank you for having us.
And good evening, everyone. My name is Dr. Raina Fumerton, and I am the Acting Chief Medical Health Officer for Northern Health Authority. I'm also very grateful to be here tonight, and also echo the comments made by MLA Oakes and MLA Rice and Cathy around my gratitude to all of you and your leadership in your communities as individuals, as community leaders. We've in the North been really successful at bending the curve and keeping our numbers low, and that is because of the efforts of each and every one of you, and would also echo the comments around the need for kindness at this time. I know it's a very stressful time as we start to reopen, and people are in different comfort levels about that in different places. In terms of their own, mental health and comfort with things. And I think it is really important that we all remain kind and patient with each other, as has been articulated. And I'm looking very forward to being able to answer some of your questions tonight. And thanks again for having me.
Thank you very much, ladies. So in advance of this town hall, we've asked people around the North to submit their questions. MLA Rice and I will take turns reading out your questions, and thankfully we have Cathy or Dr. Fumerton to answer them. And thank you again, ladies, for your incredible leadership. And don't worry if you didn't get a chance to ask your questions. You can always submit your questions in through the comment section down below if you are watching this through the BC government's Facebook page. And in fact, you can go ahead and start asking your questions now, and we'll have a chance to go over them in just a bit. So with that, let's get the program started.
Okay, great. BC has been doing a good job of holding the line to help spread COVID-19, helping stop the spread of COVID-19, correction. We're currently on phase 2 of the BC Restart Plan, where businesses are slowly reopening. Many people have questions about why we've gone ahead to do so. David in Mackenzie asks, if cases are rising this week from last week's single-digit numbers, why are we reopening in the first place? And another resident from Northwest BC adds, do you think it is a risk to reopen the economy knowing there are still cases in our communities and knowing that a second wave may be inevitable? Who wants to take a stab at that one?
Well, I can start, and then maybe Cathy, you can add to, if you have anything to add. But I mean, certainly we have sacrificed a lot as a province and as individuals in order to successfully flatten and bend the curve in British Columbia. And I think we are all very interested in keeping those numbers as low as we can. That said, we need to appreciate that this is not a disease where the focus is on elimination, and numbers are going. We can't stay in a position where the economy is completely closed down indefinitely. We know that economic activity, basic income, having a job, employment opportunities, those are actually really significant direct contributors to our health of ourselves, of our families, and of our communities. And so I would say that it is the right time. We have bent the curve. We have got our numbers to a very controllable level, and the dance that we're going to have is about slowly, cautiously, carefully reopening things in a measured way, in a staggered way, and in a safe way. And I think there's been a lot of effort gone into helping create guidelines to that effect. And I think that that is going to serve us very well in terms of being able to both reopen the economy, reopen healthcare services, and all kinds of other things that are really important for a healthy and thriving community, while at the same time keeping our numbers controlled. And so we will be keeping a very close eye on that. And of course, as we always have been doing, every time we have a case, we do very thorough and extensive case and contact follow-up to try to control and contain where those cases are. We have a very permissive and high capacity testing at the moment. And so we will be watching over the next few weeks how the numbers evolve, and then we'll be adjusting accordingly. So the incubation period for coronavirus 19 is anywhere from 2 to 14 days. So we will have a good sense over the next week, since we've started reopening, how that has impacted our numbers. And then we would be taking a strong look at where we go from there and how to adjust based on that. Always trying to keep in mind that our goal here is not to prevent all cases or to eliminate this, because that's not a realistic or achievable goal, but it is to ensure we keep the numbers controlled to a level where we don't, A, overwhelm our healthcare system, and B, that we are trying to ensure that we protect the most vulnerable in our communities, our elders, for example, long-term care facility residents, and so on. So I'll leave it at that, Cathy, and please fill in if I've missed anything from your perspective.
No, I think you've covered that well. Thanks.
Well, maybe on that question, while some folks are cautious about opening up too quickly, there are others who are looking forward to a future where many people can get together without having to be mindful of some of the safety measures Simon and Quinnell asks. What is your best guess for a timeline for group meetings of up to 50 people being able to take place without the need for face masks?
Mm-hmm. So at the moment, there is a public health order around mass gathering events. That order is sets a limit of a maximum of 50 people. So if the number is under 50 people, which I believe is what was alluded to in this question, and that those events are permitted to occur in a safe way following the public health recommendations. And so masks are not required for gatherings of under 50 people. Essentially the most effective ways to ensure that, any kind of events where there are more than 50 people, that you're practicing good appropriate social distancing, so that the 2 meters separation, good hand hygiene, and really important is just simply staying home if you're sick. I know it sounds simple, but that really is a critical thing and the right thing to do. So if you know that you're not feeling well or have any symptoms whatsoever, to stay away, and then implementing those sort of engineering controls, physical distancing, the good hand hygiene, good cough etiquette, etc. And so hopefully that answers your question. Cathy, anything to add there?
I think the only thing I would add, I think the question asks if we have a best guess, and I don't think at this point we do have a best guess on that. I think we'll be watching over the course of the next few weeks how the lifting of some of the restrictions goes and what the impact of that is, as the provincial health officer together with the BC Centre for Disease Control looks at the evidence and makes future decisions. But until then, I think the current restrictions around mass gatherings will hold. And I think there's really good reasons for us to respect that and to think carefully when we're gathering about how we're feeling and the impact that we have on others.
Yeah, thanks, Cathy. And certainly, while there are, orders, there are also just general recommendations. So just to clarify that there's an order around mass gathering events of no more than 50 people, but that's not to say that those events are sort of being actively encouraged necessarily. And so really trying to be very cautious and careful about how you expand your social bubble in it, for lack of a better word. And then as you do so, again, trying to keep those public health recommendations in place while you do so.
Okay. Well, many of us, including myself, are waiting to get a haircut. We're waiting for our appointments, and because, well, it's been a long time. With that in mind, Audrey in Prince George would like to know, what safety precautions must barbers adhere to in order to open? Some appear to be back as they were last year.
So I had the good fortune of having my haircut this week. So it was a pleasurable experience. And the salon that I went to did attend to the directives from the PHO and what's outlined in WorkSafe BC. And every personal services type establishment, like salons, barbers, do have to have a safety plan for their particular operation. And that safety plan does look at the risk of exposure and the ways in which they're going to attend to the recommendations from both WorkSafe BC and BC Centre for Disease Control and the Provincial Health Officer. And they have to document that and have that available for WorkSafe BC. So there are some pretty clear guidelines on the WorkSafe BC website regarding the various kinds of industries and some of the things that will need to be put in place for people to reopen safely.
Yeah, I too look forward. Well, I'm very jealous, first of all, Cathy, and I do look forward to that first haircut. Sort of like the first shower after you've been backcountry camping for several days. Only slightly different. Yeah, and the plans are very well thought out, as Cathy alluded to. They can be found on the WorkSafe BC website, and it includes, there's I think a lot of thoughtfulness from what I've seen going into all kinds of businesses reopening. They are just being so thoughtful and careful, to the best of their ability, putting in everything they can to keep their clients and customers as safe as possible. And so for hair salons, for example, there's guidance around how to manage the clients and performing the services safely and ensuring that there's the safety and cleanliness of the environment, of the tools that they're using, enhanced cleaning and disinfection. So there's a lot of support out there for business owners, hair salons and otherwise, to be able to reopen in a safe manner.
So here's a question about dental clinics and COVID-19 from Caitlin in Fort St. John. In a dental clinic, in order to ensure aerosols and proper disinfection are upheld to reduce the speed of COVID, how long is the time required to do so?
Maybe I'll start on this one, and then Raina can add to this. One of the things that has been part of the reopening process is that the regulatory colleges that regulate health professions are providing guidelines to the professions that are part of their college. And the College of Dental Surgeons is no exception. And they have provided some really good guidance on their website for dental clinics around how to safely reopen. And certainly in this question that has been asked, it really is about things like the cleaning that occurs within a dental clinic, personal protective equipment that is available within a dental clinic, and then looking at things like air exchanges and so on within the environment. And there's some really good guidance that dentists and dental clinics have available to them through the college as well as through WorkSafe BC.
Yeah, nothing to add, Cathy. Thank you.
Okay. In order to prepare for the pandemic, I know our government made the very difficult decision to cancel elective surgeries so that our hospital system would not be overwhelmed. Surgeries are now being ramped up. Christine in Kitwanga asks, checking with my surgeon concerning my canceled surgery, and he is only getting 1 day of surgery a week. Will this be increasing anytime soon?
Elective surgery being canceled was, I think, a real hardship for some people. And it was something that I know the Ministry of Health and the health authorities were anxious to restart as soon as possible. And it's been one of the first things that we focused on as a health system. We did start surgery in the north last week, and we are following the surgical restart plan that the minister released a couple of weeks ago. Last week, and into this week, we're functioning at about 70% of our capacity in terms of surgical capacity to what we were prior to COVID-19. And we'll be slowly ramping that up as we get familiar with some of the new processes that we have to have in place in our surgical departments. We are calling all of the people on the wait list. And at this point, we have called about 26% of the people who are on the wait list for surgery in Northern Health. And finding out if people are ready and able to have their surgery. And then we'll be proceeding to book them according to priority need. And that work is well underway. I'm very grateful for the surgical departments, anesthesiologists, GP, anesthetists, and our surgical staff, nurses, and others, housekeepers, and so on, who really make it viable for us to be able to be at 70% of our capacity, or our pre-COVID capacity. So we are making progress on this, and it's really important that we do so.
So in order to stop the spread of COVID-19, British Columbians are advised to avoid non-essential travel and enjoy their local parts of the province. We received a few questions from people in this particular region who are asking, what does staying close to home mean? So Margaret in Dawson Creek asks, Dr. Henry advises us that we vacation in British Columbia. Is that because of distances to travel or because of COVID conditions in BC and Alberta? For us in the Northeast, Alberta is so much closer than most places in British Columbia.
Thanks. I can start with an answer to that one, and please add, Cathy, if there's anything I've missed. But currently there are no orders around restricting interprovincial travel. As you stated, our PHO has encouraged all BC residents to avoid non-essential travel. And so that would include to other parts of BC or to Alberta, and to really stay close to their home community as much as possible. That said, if you need to travel beyond your home community and the proximal region, like right around that, then I think what's important is just to ensure that you're respecting the public health guidance, being respectful when you are going into other communities, ensuring that you are adhering to the various public health measures and practicing those precautions. We are moving carefully into phase 2. As stated, we're very encouraged by what we've seen so far, and we will continue to monitor the numbers over the coming weeks. But certainly at this point in time, non-essential travel is not encouraged, and really staying close to home as much as possible is. So looking to understanding the numbers a bit better come mid-June, and we'll have more data to determine timing for further actions at that point.
Okay. We know that many seniors around BC and in the north are also feeling the impacts of COVID-19. Karen in Smithers asks, I'm an immune-compromised senior in full isolation. How will I know when it's safe to have contact or do my own errands?
Mm-hmm. Yeah, that's a great question. And certainly I know there's a lot of anxiety in general, but in particular, older people with chronic health conditions like diabetes, heart disease, lung disease are at higher risk of developing more severe illness and complications from COVID-19. That said, for many people, including seniors, staying at home for long periods of time isn't a viable option. We're in this for the long haul, potentially for several months, if not a year to 2 years. And so I think, generally speaking, the best way to protect yourself is to take those same measures that you would during flu season. Washing your hands, try not to touch your face, ensure avoid large gathering events. But I think, as has been discussed, a lot of, in terms of being able to go do your errands, do your groceries, the local retail stores, et cetera, have been doing a really great job at putting the safety mechanisms into place and having very thorough, well thought out safety plans. And so it's, I think, as long as you're ensuring that you're washing your hands before and after, maintaining the social distancing, et cetera, and trying not to touch your face, then it's safe for you to go out and do your essential errands. And again, it's probably not realistic to not to be on total lockdown for several months on end. But that said, being very careful when you do go out, as I'm sure you will be, and taking all of those precautions, and then just limiting the frequency with which you need to do that. So I think that would all be very reasonable and quite safe versus just being in complete sort of lockdown for the foreseeable future.
I think the only other piece is taking a look, particularly around shopping and grocery stores, is times when they're less busy. And some stores have actually created times where seniors, for example, can shop where there's less volume in the stores, and I think that really is helpful for people who may have health concerns of their own beyond COVID-19.
So, along with seniors, families have also changed routines because of COVID-19, and that also includes the topic of how to handle heading back to school. Christy in Prince Rupert has this question. Can you please explain as to why, if someone in a household has symptoms or a test positive case of COVID, that their child will be able to attend school or childcare as long as they are not showing symptoms? Children are known to have mild or non-existent symptoms, yet they can go to school and infect their classmates and teachers?
Thanks for that question. Children, anyone at the school, be it staff, be it any of the children, if they have symptoms themselves, the recommendation is indeed that they stay home, and that they are assessed by the healthcare provider and provided with testing for COVID-19 if their symptoms are compatible with that. If someone is considered a close contact, of which a household contact of a confirmed case of COVID would be considered a close contact, child or otherwise. Close contacts are recommended to self-isolate regardless of whether they themselves are symptomatic or not, and they would need to self-isolate at home for the 14-day incubation period, during which time we would be assessing daily for whether they develop symptoms. If they develop symptoms, they would then be tested. So close contact, household contacts of confirmed COVID cases would not be attending the school environment. And schools have strict protocols, enhanced infection prevention being put into place. They are coming up with their infection control and safe return to school plans as well. So hopefully that answers that concern. Cathy, anything to add to that?
No.
Okay, well, thank you. Thank you for that answer. And believe it or not, time is flying. And this is the last question that we have because we have to move on to the live questions. So many of us like to head out and get exercise, but with this pandemic, it does raise some questions. Angela in Dawson Creek asks, my son is a competitive swimmer. I'm wondering, will swimming pools be opening? If so, in what phase will they be opening and what will it look like?
Mm-hmm. Yes, so recreation and sports facilities will start to open in phase 2. So it's an excellent question. Over the next few weeks, many sectors, including things that have been closed thus far, like community centers, ice rinks, swimming pools, public libraries, they are making plans and establishing their own safety protocols around how they can reopen safely in line with the public health guidelines. And Northern Health public health staff will be working with those facilities to support their reopening plans. But it's best to check with your local municipality with more details specific to the local operations.
So I think we're going to go to live questions now. Carrie on Facebook has asked, other countries are reporting that diarrhea is a symptom of COVID. Is it a standalone symptom or is it a combination with other symptoms?
Yeah, that's a really good question. And certainly COVID being a completely new, COVID-19 being a completely new illness in humans, we are learning about it as we go, and your audience member is absolutely correct. One of the features that we're noticing to become more of a prominent common feature is diarrhea. And initially, it was thought that diarrhea alone was quite rare to present, that it was often in combination with at least one other sort of respiratory symptom. But we are learning, and I don't have the exact numbers, but we are learning that diarrhea as a standalone symptom is certainly possible. And so that is something that we are learning about as the evidence evolves. It's been that, as well as some of the other interesting symptoms that people are getting with COVID, like a lack of ability to smell, is another interesting one.
Thank you for that. Susan has a question. I was wondering if there will be health professionals available to speak to the students who may be having mental health problems in regards to COVID-19, especially the little ones in elementary schools. I
think anxiety and concerns, mental health concerns, have been prevalent throughout this entire experience for many people. And we have tried as a health authority to make resources available together with our colleagues in the Ministry of Children and Family Development to people. And through the virtual COVID-19 clinic, we've been adding in some mental health resources there. But certainly within the local community, I think through the community services, if this is something that a school felt was really important, that would be a conversation that could be had. And I think somebody would be able to provide resources to the school or do what this question has suggested, have some opportunity for some conversation about how the pandemic has affected people's lives and children's lives as well.
So another question from Facebook is, should I self-isolate after traveling to Fraser Health for a scheduled surgery next week upon return to Northern British Columbia?
There isn't a requirement to self-isolate. There is a requirement for people to self-assess how they're feeling. Make sure that if they have any symptoms that are like respiratory symptoms or like COVID-19 symptoms, that they let their healthcare provider know that. But there is, at this point, no requirement for self-isolation unless you're symptomatic. Did you want to add to that, Raina?
No, that's entirely accurate. Thanks.
Okay, Mallory has a question. Will antibody testing be made available in the Northern Health region?
Certainly, antibody testing is going to be a very interesting and useful tool to help understand both the level of exposure to the virus throughout our communities, as well as being able to understand whether or not that exposure has also provided our population with a level of protection and immunity to the virus. Right now, they are currently sort of at a pilot stage, so conducting initial sort of research type of trials on serology. There's certainly at some point in the near future going to be opportunities for more broad population level testing in the province of BC. I don't have precise dates on that, but that would absolutely include Northern Health region. Cathy, anything to add on that serological testing?
No.
Lynn from Facebook asked why some provinces or even in BC can tell where the cases are in towns, but we can't know in Northern Health.
Mm-hmm. Yeah, I appreciate that. That has been a source of frustration for some people. Hopefully people can understand that this decision was made with a lot of thought, and the concern around releasing small numbers. We have seen quite a bit of stigma associated with COVID-19, and particularly in small communities where it's easy to identify people. And the fact that not everyone is being tested, and so not having a positive cases, lab confirmed cases announced for your community does not mean that we should be lifting any precautions or doing anything differently. Likewise, if there is a case in your community, it need not set off widespread panic, because the numbers and the cases are very much under close watchful eye from public health, and we continue to follow up and isolate all cases and close contacts to the highest degree possible. Again, the decision was made at a provincial level that we would be reporting out our numbers at a health authority level. And I think the argument that if we don't know that there are cases are in our communities, and how can we take those extra precautions. And I would argue there's no extra precautions you need to take if there are cases in your community, nor should you have a false sense of security if there aren't cases in your community. So I think it's privacy and confidentiality of data, particularly where there's an illness with quite a bit of stigma attached. And I think we're getting better at that, and that it is being normalized, and people are taking a much more supportive approach, understanding that this is a virus that's not going to be eliminated, but it's something that we are going to try to control slowly. It is helping, but and I recognize that different jurisdictions have taken a different approach, and there are pros and cons to any approach that one takes, but that's just the decision we've made in BC, and I support the decision and the approach. Anything to add, Cathy?
Yeah, I think the only thing I would add there is that there are some occasions that people would have noticed in British Columbia where we did in BC identify a particular long-term care facility or a particular community where there was a facility like a corrections facility that had an outbreak, or in the case of some of the food processing plants in the Lower Mainland, that was identified as well. I think I can remember at least one community where there was a case where the contact tracing was more challenging, and there was a need to let the community know that if they'd been in contact with this person in this particular setting, that they may want to be tested. So there are just particular circumstances where I think Dr. Henry and the Chief Medical Health Officers felt that it is prudent to release that information and to help with the control. But in general, as Raina said, the provincial direction has been to keep the information at the health authority level.
Mm-hmm. Thanks for articulating that, and certainly where there is a significant sort of public health risk to the general public, where we, for example, the dental conference that occurred in the Lower Mainland, where there were quite a few cases that emerged from that, it was not possible to follow up with each and every person that attended that, and so a much more efficient and effective way to ensure people are aware that they were potentially exposed to the risk was to make a public announcement about that for very specific purposeful reasons, and of course declared outbreaks in long-term care facilities and in other closed settings are also scenarios where it has been deemed important to identify that to the public where there's potential public risk.
Thank you for that. I know that was a question that has come up and come through my office numerous times. I'm not sure about you, MLA Oaks, but I did certainly hear a lot of people wanting to know where the locations were. I think it's important that you've addressed that question, so thank you. Richard asks, do you think kids going to school will cause an increase in infections?
Thank you, Richard. I think that as we move into phase 2, we are carefully reopening a variety of sectors and settings. And so we do expect to see increases in cases, and what we need to do is ensure that there's a balance such that the increase of cases does not exceed the numbers that to the point where we're not able to control, as we have been doing thus far. I think children and school, it's very important that children receive an education. Educational system is such an important part of a childhood experience, and it's extremely important for their health and growth and development. So there are certainly unintended consequences for children not being in school, and they've not been in school for quite some time now. Children are an interesting, with respect to COVID-19, an interesting demographic in terms of the dynamics of the disease. And so we know that children tend to actually fare very well when they are infected. Many don't have symptoms or are only mildly symptomatic. Very few children become severely ill. with COVID-19, and in general, they don't seem to be big spreaders of the disease as well, potentially partly because they don't become very symptomatic. And so where children do seem to show a more likely spread is to their own household close contacts. So we haven't, the evidence doesn't suggest that there is a lot of spread from children to others in settings outside of the household close contact setting. It's not to say, of course, that it cannot happen, but I think that there's going to be spread. There will be cases as a result of the reopening phase and from school settings. And I think the important thing is that we continue to closely monitor and ensure that if children are sick, that they stay at home. That we ensure that when we do identify cases, we're very quick to ensure that we are doing all the appropriate follow-up to any contacts. And although many children have asymptomatic disease, I just want to emphasize again, there's really not any conclusive evidence that children who are asymptomatic actually pose a risk to other children or to adults.
Cloth masks stop large droplets, but what about the aerosols that can hang in the air for hours?
Mm-hmm. So cloth masks are sort of, I would say, the very kind of last line defense in terms of what would be recommended and what we know to be effective. I think we're still trying to learn about the evidence around cloth masks. In British Columbia, we have completely bent the curve without requiring cloth masks, and have done an excellent job doing so. So while cloth masks are an option where for people who wish to wear them and for scenarios where physical distancing is not possible, the fact is that these are not medical grade masks and are not made to actually filter out extremely small particles. So these are not sort of medical grade N95 masks. Every cloth mask is slightly different depending on how it's made, what fabric is used, etc. And so I think the evidence around how effective a cloth mask would be, to answer your question, is unknown about how effective it would be at preventing those particles from getting through the mask.
Yeah, I think the guidance that has been provided provincially and nationally is that the cloth mask is an option when physical distancing is challenged, as Raina's described. And when we think about the hierarchy of actions that we can take to protect ourselves, I think first and foremost is that physical distancing, avoiding mass gatherings, some of those kinds of actions that we've talked about tonight. And then the next layer would be some of the things that you see happening in stores where there's some engineering kinds of things put in place, like barriers and so on. And then the third layer is the kind of administrative policies that organizations like Northern Health might put in place about people not coming to work when they're sick, those kinds of things. And then the last piece really is around some of the personal protective equipment that and certainly in the healthcare setting, those are critical because that direct contact between the patient and the provider is unavoidable and necessary. But in places where you can physically distance, in terms of that droplet piece that's in the air, avoiding mass gatherings, keeping physically distanced, and keeping your social circle to be those that you know, and staying away when you're ill, I think are just really critical pieces. And a cloth mask does not replace those actions, but it can help in those situations where some of those things are more challenging.
Right. Clayton asks, can you talk about some of the challenges you face with respect to providing treatment for COVID-19 to people who live in remote and rural Indigenous communities?
We've had a very good working relationship with the First Nations Health Authority through this experience. The executive director in the north was part of our emergency operations center, and we had a working group with First Nations Health Authority and Northern Health, and also talked to health directors over the course of the planning that was undertaken. And there's a number of challenges that I think are unique to First Nations communities. One is the requirement to self-isolate, and sometimes that is more challenging than at other times. And First Nations communities are going through a process of identifying what some of their needs are in that regard. And the First Nations Health Authority has been very instrumental in looking for options. We have tried to be a good partner there in terms of identifying places where people can self-isolate safely if they need to leave their community. The other challenge is really the patient transportation piece and getting to a location that has acute care, critical care capacity quickly. And BC Emergency Health Services, under the Provincial Health Services Authority, has been part of that working group in looking at what is the surge capacity that would be needed for BC Emergency Health Services to be able to respond to remote and rural First Nations communities. So those are just examples of a couple of areas. I think access to primary care is limited in not just in First Nations communities, but many rural remote communities. And the Rural Coordination Centre of BC has done some really excellent work with the health authorities around a virtual Doctor of the Day program that's been made available for First Nations communities in particular. So those are some of the things that I think are unique challenges. In the early days, there were some challenges with accessing testing, and there's also been a lot of work in that regard. And I know First Nations Health Authority is looking at testing equipment that can be located in some of the more remote parts of the province.
Rianne has a question. When will doctor clinics reopen back to normal, for example, in person?
I think the same kind of risk assessment and safety plan that all of us are doing apply to medical clinics as well. Many physicians have been providing virtual care during this time and going above and beyond to provide virtual care either by telephone or through video conferencing, and have tried to make themselves available in that way. They certainly have done their share of supporting the virtual COVID-19 clinic in the north, and I know that practice right across the north are working with primary care providers to support the thinking around how to reopen. Some medical clinics have already reopened, and some are planning that reopening. But I do think that will be happening very soon for many primary care clinics.
Okay. Caroline, is there any timeline when there may be some limited visitation for elders in long-term care?
This is a real challenge for families, and I have a lot of sympathy for families who have loved ones in long-term care and haven't been able to see them other than virtually. I can imagine how challenging that is. The reason for it is to protect a very vulnerable population and to ensure that we restrict the amount of traffic that comes into a facility to very essential kinds of visitors. During this early part of phase 2, we have in the province made the decision to continue to restrict the visiting and restrict the traffic into long-term care and assisted living environments. And just to monitor how this reopening goes, And I know that as we gain experience with reopening, that this is an area that will be looked at by the Ministry of Health and the Provincial Health Officer. But at this point, it seems prudent and wise to protect that very vulnerable population in the way that we have been until we know more about how the reopening is impacting our communities.
Well, we're reaching the end of the town hall, and with a couple of minutes remaining, I have one more question for our guests, and actually it's a personal one as well, as I know I share it. For many of our loved ones, they have health conditions that they should be going in, and they should be getting regular checkups, whether it's when you're looking at if you have health or heart care issues or anything like that. I can share personally that GR Baker has done an incredible job in Quesnel in making my family feel so comfortable with, addressing their health concerns and challenges. And I just appreciate so much the efforts that they've made. But do you have advice for anyone out there in Northern Health that may still be a little bit reluctant to go in and be taking care of those emergencies as they come up, because we still hear that there's reluctance from folks in making sure that they're taking the necessary precautions with their health?
The emergency departments across the region, the nursing staff and the physicians within the emergency departments have done a lot of work to create a safe way to provide care within those environments. A way to separate those who have respiratory and those who don't, a way to make sure that that physical distancing can be accommodated as much as possible, and that it is a safe place to go. And I would strongly encourage people, if you have a health emergency that you believe you need to be seen within an acute care environment, to go and have your needs met. We certainly, the primary care providers, as those practices open up, I think it's always good to check in with your healthcare provider if you're able to do that. But if you are having an emergency, you need to go to the emergency department, and they are a safe place to go to.
Okay.
Well, thank you again, and thank you again to everybody who's on the front lines in Northern Health that are doing an exceptional job. And with that, back to you, MLA Rice.
Well, thank you, Cathy, and thank you, Dr. Fumerton, for your time this evening. We would like to thank all of you for joining us tonight, especially our guests and my co-host. I want to offer a thank you to Health Minister Adrian Dix and Dr. Bonnie Henry for the work they are doing and for the opportunity for all of us to connect this evening. Anxiety levels have been particularly high in many First Nation and remote communities I represent. Resources are limited and travel is hard at the best of times. I just want to take the moment to acknowledge your concerns and let you know that we've got your back. I hope tonight's town hall has provided some answers to your questions. Before we wrap up, we want to leave you with a few additional resources. MLA Oakes, would you like to begin?
Thank you. For provincial support and COVID-19 information, visit gov.bc.ca/COVID-19. This includes non-health related information such as financial, childcare, and education supports, travel, and essential service information. This information is, of course, also available by phone, and you can call 1-888-268-4319 or 1-88-COVID-19. It's open 7 days a week between 7:30 a.m. and 8 p.m. Pacific time. And for the latest medical updates, including case counts, prevention, risks, and testing, visit the BC Centre for Disease Control's website at www.bccdc.ca.
That's a mouthful. If you or a family member need additional medical advice, you can always and please do call 811. For seniors looking for additional support at this time, please call 211 or visit bc211.ca. You can also go to bc211.ca to sign up as a volunteer to support our seniors staying safe.
And you can also find information and links to these and more additional resources in the description of this town hall down below. And if you haven't already done so, please fill out the province-wide public health survey, BC COVID-19 Speak, Your Story, Our Future. And finally, local data are essential for communities to support public health planning. Your input equips medical health officers across British Columbia to support our health and well-being as we all learn to live with COVID-19. The survey takes about 10 to 15 minutes to complete, and you can do it online at bccdc.ca/COVID-19 survey. I'm sure this is all up there, or by phone at 1-833-707-1900, 7 days a week between 8:30 a.m. and 4:30 p.m.
As we move into phase 2 of BC's restart plan, let's give this every chance of success in this phase by continuing to do what we've been doing all this time, staying 100% all in. Let's continue to follow the public health guidelines to protect ourselves and our loved ones and stop the spread of COVID-19 in BC. For more information on our BC Restart Plan, visit gov.bc.ca/restartbc. Thank you again to everyone for joining us this evening. Be calm, be safe, and most importantly, be kind.
Thanks, everyone.